Doctor, my papa died because when I give glucose drip, even after I be tell when I say he be diabetes patient. That's what one of my patients' carers told me after she lost her father. Her father was a diabetic patient and was rushed in one evening in an emergency. They said he was sweating profusely and just stopped talking. By the time they got to the hospital, he was unconscious. The first thing they told us was he is a diabetic patient. Immediately, we took his blood sugar and it read 43 milligrams per deciliter. That is very low, and it's what we call hypoglycemia. That is low blood sugar. So immediately, I asked for glucose drip to be set up. As the glucose drip was set up, I proceeded to take a full history to know exactly what went on in the house before they came to the hospital. A family entered the room, saw glucose written on the drip, and then ran out shouting, "Then they give Papa glucose!" Oh! I got confused. I was like, what's happening here? All of the family members who were standing outside rushed into the room and insisted that we should stop the infusion because their father is diabetic and he's not supposed to be taking glucose infusion. I tried to explain to them what is happening, but they were adamant. In fact, they eventually said that they want their father discharged against medical advice because they don't seem to trust what we were doing. One person actually dragged the cannula out of the patient's veins and then started bleeding. So we're now trying to manage the bleeding. As they took the man to leave, we eventually heard that he died on the way to the next hospital that they were going to. What am I trying to tell you here? As much as diabetes means that glucose or sugar is high in blood, there are some instances that diabetes patients can actually take glucose drip or infusions. For instance, in cases of preventing or treating low blood glucose, we give patients glucose to bring up their blood glucose levels, because if your cells don't have glucose to manufacture energy, it can lead to the cell death. Even in cases of high glucose levels, there is an infusion called GKI, glucose, potassium, and insulin, that we give to help control the blood glucose levels of patients. My people, no doctor or health professional goes to work with an intention to kill patients. All we want to do is save as many patients as we can. If you have told your doctor that you are diabetic, be rest assured that they are doing everything with that information in mind and with the intention to save you. Please listen to your doctor when they talk to you, because they know what they are doing.